Hello and welcome everyone. Through this knowledge clip, we would like to explain how operations are managed inside a hospital. These management operations are divided into 5 different management functions, namely managing facilities, capacity management, supply chain management, service management, and lastly, quality management. By fulfilling these management operations, it helps the organizations to ensure a great working process inside a hospital and to make sure that they deliver the highest possible quality of service to their patients. We hope that by the end of this video, you will have learned more about the different management functions inside a hospital.
The hospital can be seen as a hybrid manufacturing firm. It is a hybrid of a fixed position, process, and cell layout. There is a fixed position in terms of the large hospital equipment and the rooms that a hospital uses in order to deliver its services. Some examples are an X-ray machine, an MRI, and operating rooms. The operating rooms and the large hospital machines are stationary and therefore the recipient of the process comes to the service. The reason that a hospital can be seen as a fixed position layout is that there are specific requirements set by the government concerning the equipment and the rooms. For example, hygiene, security, and layout requirements. Additionally, there are higher maintenance and unit costs attached to the equipment use. In terms of the individual customer needs, a hospital uses a process layout as most processes in the hospital are job shop or batch processes. The customer travels to the resource instead of the resource traveling to the customer. When a doctor makes a referral, the customer is required to move from one area in a hospital to another. A cell layout is applicable to a hospital as specific areas are designated and capable of completing a particular service. An example would be a cardiology department. Within the hospital, there is a greater focus on the servicescape than on the manuscape because there is a focus on delivering services. They focus on creating a clean and wide environment which projects a particular image for the hospital. Capacity management. Capacity is the maximum possible output in a given time. A hospital can use units like numbers of available beds, rooms, staff, and operating rooms as units to describe their capacity. Undercapacity occurs when there is too much staff, machinery, or facilities idle, costing extra money. Overcapacity leads to dissatisfied customers, and in the worst-case scenario, a lower success rate. Appointments are made in order to manage capacity. Forecasting could be used to estimate the emergencies and unplanned occurrences. When managing appointments, it is important to look at the external factors as well. This is done by using regression analysis, where dependent and independent variables are compared. Inventory management. Inventory management is the planning and the controlling of inventory in order to meet the competitive priorities of the operation. It is important to maintain a sufficient stock to keep up with the needed amounts of medicines, equipment, and donor blood. This relates to the capacity management. Without sufficient inventory, the maximum capacity cannot be achieved. A way to manage inventory could be by using the ABC classification. ABC classification is a way of categorizing inventory items by cost and usage. Class A items have the highest value and they contain 10% of the quantity of all inventory, but make up 60 to 85% of the value. This could be donor blood. Class B items make up 20 to 30% of the total inventory quantity, but only are 10 to 25% of the inventory value. Surplus of this inventory exists as it is less valuable than Class A items. Class C items are the least valuable. They make up 70 to 85% of the quantity and 5 to 15% of the value. For example, paper towels, surgical gloves, and scrubs. The way hospitals manage their capacity is done by using a chase demand strategy where inputs are adjusted so that the outputs match demand. The chase demand strategy can be used so that the appointments made in advance may be used as a forecast so that the hospital can schedule their staff as efficiently as possible in order to match demand. They do this by making use of flexible work schedules and by scheduling machine and room usage, which eventually leads to increased efficiency.
Service management.
Employees will routinely come into contact with many customers, so there will be many service encounters. The success of the service encounters will be influenced by many factors, such as the staff attitude, recruitment and selection of suitable employees, appropriate induction and training of said employees, empowering frontline workers, systems for optimizing the service encounter, monitoring service encounter performance, the culture, communication effectiveness, and control and efficiency of the service encounter.
There are different queuing systems used in a hospital. Mostly, queuing is based on having an appointment. This can be compared to diffuse queuing, in which there is no actual line. Customers are waiting in a waiting room while being able to read a magazine, drink some coffee, or watch some television. Queuing of referrals is first in, first out. However, in an emergency situation, customers are able to skip the queue as they enter through a priority lane.
Supply chain management. The supply chain is a network created amongst different companies producing, handling, and/or distributing a specific product. Specifically, the supply chain encompasses the steps it takes to get a good or a service from the supplier to the customer. Supply chain management is a crucial process for many companies, and many companies strive to have the most optimized supply chain because it usually translates to lower costs for the company. Quite often, many people confuse the term logistics with supply chain. In general, logistics refers to the distribution process within the company, whereas a supply chain includes multiple companies such as the suppliers, manufacturers, and the retailers. The most important issues of a supply chain are the length of the chain, the complexity of the chain, stability, physical, informational, and the monetary flows. The model on the screen shows the supply chain of a hospital in a simple and theoretical way. In the reality, it is more complex. The reason why a hospital brings in line their supply chain is to focus on lowering costs while improving outcomes. The benefits for a hospital to have a structured and clear supply chain are improved nurse workflow, improved patient safety, greater efficiency at the system level, and simplify reporting and analysis. The model now projected on the screen reflects the reality of supply chain from a hospital. It shows that it is often not that structured as it has to be. Hospital struggles to have an efficient supply chain because there are so many different groups they can place in it. In order to improve the supply chain, the hospital should improve collaboration with the pharmacy services, the infrastructure design, the competency training, and the performance tracking management. The ultimate goal is to have a perfect supply chain which consists of an efficient integration from drug manufacturers, wholesalers, pharmacies, and hospitals in order to provide a supply of the right amount of drugs at the right place at the right time.
Service failure is almost inevitable. Probability of service failure is increased by new employees, technological breakdown, and first-time customers. Service recovery is the action taken in response to a service failure with the aim of restoring customer confidence and satisfaction. In hospital, the confidence of the customer towards the hospital is the main affected part when a service failure happens. The trust and the loyalty will go down. It is important that there are possible recoveries available at all time, especially with important vulnerable surgeries. Therefore, it is important that service failure is minimized and fail-safe devices are used, such as a poke-joke. This relates to quality management. Quality management. Quality is the features or characteristics of a product or a service that satisfy the stated or implied needs. Perception-based views always dominate over the performance-based views in the eye of the customer. For instance, the hospital will have certain objectives and processes to manage the security and the hygiene of the hospital, which are both extremely important. However, the customer just assumes that these things are taken care of. Within the hospital, the total quality management is important. Continuous inspections before, during, and after the service are required in order to keep up with the set quality standards. Usage of poke-jokes, which are fail-safe devices, help prevent service failure. Poke-jokes have been used in the healthcare sector in order to prevent life-threatening mistakes. The safety of patients can be threatened by human errors and faulty medical devices, and poke-joke techniques, when used together with employee training, can reduce the chances of these errors occurring. An example of a poke-joke used in a hospital is surgical equipment positioning requirements that control the location of the equipment and if the right equipment is used.